Notice how many people on this planet have eczema, psoriasis, skin issues. Well, you know immediately that that is tied to the lymphatic system. But anybody with a skin problem really want to go after this. Most skin problems do not take that long to get rid of. You should be able to get rid of most skin problems if you're focused on kidney filtration, lymphatic work. It should only take you 3 to 6 months. If some of you are lingering longer, then take a look at what you're doing, lifestyle, and of course, again, remember this. Every single person is different. Every single person's lymphatic system is different because of why. Not because of we're all Homo sapiens, it's because of the genetic lineage, where you were born, the types of foods you ate, the level of protein and dairy consumptions you had. That all determines just where your physical body is today. Look at all the skin conditions. Those are lymphatic conditions. And for a dermatologist not to understand the lymph system and acids and the relationship with that skin confuses me. Confuses me, to say the very least, and disappointing, to say the very most, that you have professionals out there helping people with creams and things that actually are serious, causes serious problems, like all your corticosteroid creams. You know, they're ruining people's adrenals, and they just don't get it. And it's time we all come together as practitioners and unite at these higher levels of healing. No one that I know of through all these years of acne and cystic acne and psoriasis ever gets cured of it by taking antibiotics and through dermatologists. I've never seen a dermatologist. It can go away temporarily when you get the bacterial action and you're suppressing with the bacterial action of an antibiotic and the lymph suppressing factors of the antibiotics. Yeah, then you're going to see, you can see, but there's going to be a point where you're too chronic. There's nothing to suppress anymore. And that's the problem. You dermatologists, forget topical. Go internal. Learn detoxification, and your practice will really grow. It probably already is full of people that you can't help. You know, a lot of people have been on skin problems that have steroids and stuff like this, and all they've done is lock you into a world of hell. That stuff's got to stop. Dermatologists, you got to wake up, guys. You're suppressing, you're using steroids, you're ruining people's adrenals, and you're suppressing their lymph systems. So what you're creating is an explosive device. You ever notice that when you use your cortisol creams and you stop, it comes roaring back? Of course it does. What does that tell you? You don't have to go to school 10 years to understand that one. Is that it's suppressed your lymph system, and then when you stop, your lymph system goes, woohoo! Because you have to understand the skin is your largest eliminative organ, your third kidney. Look at dermatologists, and how many people have used cream after cream after cream on acne or on psoriasis and things like that? Never works, does it? It's steroids. I mean, it always seems to go away, and then wham, it comes back with a vengeance. We've talked about this a lot through these videos. The thing with the skin, think about skin issues, think about allergies, think about all these eruptions on skins from psoriasis and eczema. What is the skin? What role does the skin play in your human body or around your human body besides an outer protection? It's your third kidney. It's you eliminate your cellular waste through your skin. And so this tells me you're not filtering well in your kidneys, and you need to fix your kidney and adrenal glands, and your skin will come clean. Fixing things is eating fruit all day long. And this is what I recommend all of you try. Fruit all day long, as much as you want, as often as you want. I don't care how much fruit you eat, but eat fruits, berries, and melons. Grapes are my favorite in terms of detoxification, but certainly lemons are very powerful. Oranges, grapefruit, all fresh, of course. You can cure anything and everything, guys. I don't care what it is, but the lymph system, this isn't a blood problem. This is a lymphatic problem here. I had a pretty bad eczema growing up. I used those cortisone creams. You know what? I wonder, if I was a dermatologist, no offense to you dermatologists, but you guys are embarrassing sometimes to the health field. Some of the ridiculous stuff I hear, what you're telling people, is just not even professional. I mean, most of you are not understanding these are internal problems. And this is the lymph system. The skin is the body's third kidney. And you've got to address these lymph systems, and you can clear everything up. I'm going to get to psoriasis here. Same thing. You know, whenever you see skin problems, you can just pretty much realize that there's a thyroid issue at hand as well. Sweating is low. Check her basal temperatures, but getting her thyroid up is key. The second thing, remember the skin is your third kidney, whether it's acne, psoriasis, I don't care what you call it. Your skin is your third kidney. When it is not eliminating, it's backing up. And when it backs up, the lymph nodes back up, the kidneys are backing up, everything's backing up. When you see psoriasis, eczema, acne, it doesn't matter. You're having kidney filtration problems and probably more, and you're doing dairy products. You're doing too many mucus-forming foods, which you should eliminate. Look at all the skin problems we're having. It just shows the level of lymphatic issues that we're having in the body, but it's drawing the attention to this system. You notice that? It's forcing us healers to look at this system and to deal with this system, because if you don't do like we did and get into the body and look at this and try to fix this and tear it up, you're treating. And if you're treating, you're very unsuccessful. Nobody gets cured treating. But most of you that have had acne and any type of psoriasis and things like that have tried all kinds of things. Some of you have tried everything under the sun. Unfortunately, some of the Accutane bad drug syndromes have been out there, and they're still out there. And they're still to be allowed out there. I have a couple of questions about my two sons' eczema. Look at all this, guys. Look at all the skin issues. But we know they're not skin, all right. We know the skin's an eliminative organ. That's why we see it on the skin, isn't it? And what's trying to be eliminated? What the kidneys can't, right? Acids. What would turn a skin like that? You know it isn't microbes, because they fought acne with antibiotics till hell froze over. None of that's ever helped, because it's acids. You kill the bacterium, and now you don't have anybody to break down your acids. That's why you see these chronic arthritic cases are cases that have been on antibiotics in the past, steroids in the past, and now they're in trouble. Now they're really in trouble, because they've killed out, the medical doctors kill the bacteria in the body that helps to break down their acids. So now their acids are going, I'm going to hurt you. See, that's all messed up. Culturing medium, the terrain. Go after your terrain. That's the sewer system. That's the lymphatic system. I have eczema, and I'm really having a hard time. Please help. Okay, this is Sweet Girl. Well, sweet girl, don't give up, sweetheart. Your skin is your largest eliminative organ of the human body of cellular waste. Your digestive wastes aren't going out your skin. Your cellular wastes are going out your skin. It should be going out your two main kidneys first, at least the bulk of those wastes. Sounds like the bulk of the wastes are getting pushed to the subcutaneous tissues, and this is not what you want. So you want to get your sweating up, throw yourself in a salt bath now and then to help with the symptoms. Start moving that lymph, get those adrenals up, get those kidneys turned on, and you'll be successful at cleaning that skin up. But you got to move lymph or you can't clean it up. And if it's not disappearing in a timely manner, you know how your lymph system must look. So don't give up. Some lymph systems are pretty bad. Acids, you see how bad acids can get. I mean, they painful, they rip, they tear, they inflame. So, you know, they're corrosive. So really move your lymph. This is a broken record again. Thank God. Thank God this is so simple that it is a broken record. And that once this infiltrates the consciousness, wow, then you've got tools like you've never had before. Guaranteed. You know, when you see skin problems, you think, oh, these are skin problems. Oh, they lead to things so much worse. fibromyalgia, systemic arthritis, and lupuses and Lyme's. Forget the microbial thing. You're into systemic acidosis. These things are painful. These things are mutative. I can't even say enough about